Every 40 seconds, somewhere in the world, a person suffers a stroke. Before you even finish processing that thought, another life is already being changed forever. Stroke remains one of the leading causes of death globally, taking millions of lives every year and leaving many more with permanent disability. Yet what most people don't realize is something crucial. In many cases, the body actually gives warning signs hours or even days before a full stroke happens. The tragedy is that most people don't know how to recognize them. This is not about sudden fate or random collapse. Stroke is often the final stage of a process that has been silently developing for years inside the blood vessels of the brain. If something develops over time, it also creates opportunities to detect it early and intervene. That is the core idea behind understanding stroke warning signs. To begin, it is important to understand that there are two major types of stroke. The first is a hemorrhagic stroke, which occurs when a blood vessel in the brain ruptures and bleeding spreads into surrounding tissue, putting intense pressure on brain structures. The second type, far more common, is called an ischemic stroke. In this case, a blood vessel does not burst but becomes blocked, stopping blood flow to part of the brain. Within minutes, brain cells begin to die due to lack of oxygen and glucose. Ischemic strokes make up the vast majority of cases, around 85%, which is why understanding them is so critical. The brain itself is extremely energy demanding. Although it makes up only about 2% of body weight, it consumes roughly 20% of the oxygen we breathe and around a quarter of the glucose in the bloodstream. It operates continuously, without rest, and depends on constant blood flow. Even a brief interruption can lead to irreversible damage. This is why stroke is often described as a race against time. Every minute counts because brain tissue is highly sensitive to oxygen deprivation. But what many people don't realize is that the event itself is rarely truly sudden. In most cases, the arteries supplying the brain have been gradually narrowing due to plaque buildup, cholesterol deposits, and vessel wall damage over many years. The final blockage is simply the last step in a long process. Along this progression, the body often sends warning signals. These signals are usually temporary, subtle, and easily ignored. Medically, they are known as transient ischemic attacks, or TIAs. A TIA is essentially a short-lived blockage of blood flow to the brain. It behaves like a temporary stroke, but symptoms resolve within minutes as blood flow returns. These episodes can happen when a narrowed artery briefly goes into spasm or when a small clot temporarily obstructs blood flow. During that short window, part of the brain is deprived of oxygen, causing sudden symptoms that then disappear. Because everything returns to normal quickly, many people assume nothing serious happened. However, research shows that a TIA is often a direct warning of an impending full stroke, frequently occurring within the next 72 hours. That means the brain is not just sending a warning, it is signaling an urgent, time-sensitive risk window. The challenge is that these episodes are brief, often lasting anywhere from 30 seconds to 10 minutes. They can happen during ordinary daily activities, walking, cooking, or even standing still. By the time a person decides to pay attention, the symptoms are already gone, leading them to dismiss it as fatigue, stress, or something minor. But each of these episodes is essentially the brain signaling that blood flow is unstable and a major blockage could be imminent. Recognizing them can literally change the outcome between recovery and permanent damage. One of the earliest and most important warning signs is temporary vision loss in one eye. A person may suddenly experience a dark curtain-like effect, blurred vision, or complete blacking out in a single eye. It often lasts only seconds or a few minutes before vision returns completely. This happens when a small clot or fragment of arterial plaque travels through the bloodstream and temporarily blocks the artery supplying the retina. The retinal artery is directly connected to the internal carotid artery, which also supplies the brain. This means the same clot that causes temporary blindness could easily move into a brain artery and trigger a major stroke. This condition is medically known as amaurosis fugax, which translates to fleeting blindness. Neurologists treat this symptom as a serious warning because it often precedes a full ischemic stroke. Studies show that repeated episodes significantly increase the risk of a major event within a short time frame. Understanding this first warning sign is critical because it represents the brain's earliest visible distress signal, and this is only the beginning of the warning system the body uses before a stroke occurs. The next warning signs build on this same pattern of brief but meaningful neurological disruption. Pardot. The second major warning sign appears as sudden numbness or tingling, usually affecting one side of the body. This sensation can involve the face, arm, leg, or an entire half of the body. People often describe it as pins and needles, heaviness, or a strange loss of control over that side. Unlike nerve compression from sleeping in an awkward position, this type of numbness is not caused by pressure on a limb. Instead, it originates in the brain itself. The area of the brain responsible for sensation becomes temporarily deprived of blood flow, causing the body to misinterpret or lose sensory signals. One key feature that makes this symptom important is that it appears suddenly and resolves within minutes without any clear physical trigger. A person may be sitting, standing, or talking normally when it happens. Then, just as quickly, everything returns to normal, which often leads to dismissal of the event. However, this is not a harmless occurrence. It reflects temporary dysfunction in brain regions responsible for processing sensation. Because each side of the brain controls the opposite side of the body, these symptoms are typically one-sided. This lateral pattern is a major clue that the issue is neurological rather than muscular or skeletal. The third warning sign involves sudden loss of coordination or balance. A person may feel as if they are walking unsteadily, veering to one side, or suddenly becoming dizzy without any obvious cause. This is sometimes described as feeling drunk without alcohol. This happens when blood flow to the cerebellum, the part of the brain responsible for balance and coordination, is temporarily reduced. The cerebellum constantly fine-tunes muscle movement and posture, ensuring smooth and stable motion. When it is deprived of oxygen even briefly, motor control becomes disrupted. As a result, a person may stumble, feel like the ground is shifting, or experience intense dizziness. These symptoms often last only a few minutes but indicate serious instability in the brain's circulation system. People frequently mistake them for fatigue, dehydration, or inner ear issues, but when they appear suddenly without a clear trigger, they should not be ignored. The fourth warning sign involves speech disturbance. This is not occasional forgetfulness or difficulty finding a word. It is a sudden breakdown in the ability to form coherent speech or understand language. There are two key language centers in the brain. One is responsible for producing speech, while the other handles comprehension. When blood flow is disrupted in these areas, speech may become slurred, fragmented, or completely halted. In some cases, a person may still understand others but cannot respond properly. In other cases, they may speak fluently but produce meaningless or incorrect words. Even if this symptom lasts only a few minutes and then disappears, it is a strong indicator of a transient ischemic attack. The brain does not reset from such an event without cause. It is a warning that a more serious blockage may be imminent. The fifth warning sign is less commonly recognized but still important in certain contexts. It involves a combination of unusual skin pigmentation disorders, such as vitiligo, along with persistent and abnormal headaches. While vitiligo itself is an autoimmune condition affecting skin pigment cells, it may reflect broader immune system imbalance. In some cases, autoimmune activity can also affect blood vessel linings, leading to inflammation and structural damage over time. When this is combined with new or changing headache patterns, it can indicate vascular stress that requires medical evaluation. Headaches alone are not reliable indicators of stroke risk, as they often originate from muscular tension, cervical spine issues, or other non-vascular causes. However, when they appear alongside neurological warning signs or autoimmune conditions, they should not be ignored. At this point, it becomes clear that stroke is rarely a sudden, unpredictable event. It is usually preceded by multiple subtle signals that reflect underlying vascular damage. These signals are the body's way of warning that blood flow to the brain is becoming unstable. And once these warnings begin, The risk does not remain static. It escalates quickly over the following hours and days. Part 3. When a transient ischemic attack occurs, it is not just a temporary inconvenience. It represents a critical instability in the brain's blood supply system. Research shows that the highest risk of a full stroke often occurs within the first 72 hours after these warning symptoms appear. This short time window is extremely important because it represents a period where medical intervention can still prevent irreversible damage. To understand why this risk escalates so quickly, it is important to recognize what is happening inside the arteries. Over time, blood vessels develop fatty deposits, known as plaques, along their inner walls. These plaques gradually narrow the artery and make blood flow more turbulent. The vessel becomes less flexible and more prone to sudden blockage. When a transient ischemic attack occurs, it usually means that a plaque or small clot has temporarily obstructed blood flow. Even if the blockage clears on its own, the underlying problem remains. The artery is still narrowed, still damaged, and still at high risk of complete closure. This is why symptoms may come and go before a full stroke happens. Each episode is essentially a warning that the system is unstable and close to failure. The brain is signaling that its blood supply is no longer reliable. During this period, the goal is not to panic, but to act decisively. Medical evaluation becomes critical. Doctors often use this window to investigate the underlying cause and reduce the risk of a full stroke through targeted treatment. One of the key diagnostic tools used in this situation is carotid artery imaging. This test examines the major arteries in the neck that supply blood to the brain. If significant narrowing is detected, doctors can determine whether intervention is needed to restore proper blood flow. Another important evaluation is blood testing for long-term glucose control. Elevated blood sugar levels, even in pre-diabetic ranges, can silently damage the inner lining of blood vessels. This damage weakens the protective barrier inside arteries, making them more vulnerable to plaque buildup and clot formation. Smoking is another major factor that accelerates this process. Chemicals in cigarette smoke directly injure the vascular lining, while also increasing blood stickiness, making clot formation more likely. Combined, these effects significantly increase stroke risk. Blood pressure also plays a dual role. Chronically high pressure damages vessel walls over time, but sudden drops in pressure can also trigger ischemic events in already narrowed arteries. This is why stroke risk management is not just about lowering numbers, but maintaining stable vascular conditions overall. Age is another factor, but not in the simplistic way many people assume. While stroke risk does increase with age due to cumulative vascular damage, younger individuals are not immune. In fact, a significant percentage of strokes occur in people under 45, often due to genetic conditions, clotting disorders, or undiagnosed vascular abnormalities. The important takeaway is that stroke is not random. It is the result of identifiable risk factors interacting over time, and most importantly, it is often preceded by warning signs that should never be ignored. When those signs appear, the next 72 hours become a critical decision period. What happens next depends largely on how quickly the situation is recognized and addressed. Part Cat. Once a transient ischemic attack has been identified or even suspected, the next phase is immediate risk reduction and medical evaluation. The goal is simple: prevent a full stroke from occurring during the highest risk window. One of the first priorities is ensuring that the person is not alone during this period. If symptoms recur and become more severe, immediate assistance may be required. Having someone nearby who can recognize worsening signs and call emergency services can be life-saving. It is also strongly advised not to drive after such an episode. Even brief loss of vision, coordination, or speech can make driving extremely dangerous, not only for the individual but for others on the road. Arranging safe transportation to medical care is essential. Blood pressure monitoring is often one of the first assessments performed. Extremely high readings may indicate a hypertensive crisis, which significantly increases stroke risk. In such cases, emergency medical evaluation is necessary rather than self-management. Another critical point is avoiding self-medication, especially with blood-thinning drugs like aspirin or anticoagulants. While these medications can be life-saving in certain ischemic strokes, they can be dangerous if the stroke type is hemorrhagic. Without imaging, it is impossible to determine the type of stroke accurately. This is why brain imaging, usually a CT scan, is essential in emergency evaluation. It allows doctors to distinguish between bleeding and blockage, ensuring that the correct treatment is applied. While waiting for medical help, body positioning can also play a role in maintaining circulation. Lying flat with slight elevation of the legs may support blood flow to the brain. Keeping the head in a neutral position helps avoid unnecessary restriction of blood vessels in the neck. Avoiding sudden temperature changes, alcohol, and smoking during this time is also important, as these factors can further destabilize blood flow. After the immediate risk period passes, medical follow-up becomes essential. Even if symptoms do not return, the underlying cause still needs to be identified and treated. This is where structured testing becomes important. Carotid artery imaging helps assess whether there is significant narrowing that may require surgical or medical intervention. Blood sugar testing provides insight into long-term vascular health, especially in detecting prediabetes that often goes unnoticed. Heart rhythm monitoring can reveal hidden conditions such as atrial fibrillation, which significantly increases stroke risk due to clot formation in the heart. Atrial fibrillation is particularly dangerous because it can occur without obvious symptoms. In this condition, the upper chambers of the heart beat irregularly, allowing blood to stagnate and form clots. These clots can then travel to the brain and cause severe strokes. Detecting this condition early allows for treatment with anticoagulant medications that dramatically reduce risk. Each of these evaluations addresses a different part of the stroke pathway: arteries, blood chemistry, and heart rhythm. Together, they form a complete picture of vascular health. At this stage, the focus shifts from emergency prevention to long-term risk management. Understanding and addressing these underlying causes is what ultimately reduces the chance of future events or sink. Long-term prevention of stroke is centered on protecting the blood vessels and maintaining stable circulation throughout the body. One of the most important factors in this process is blood sugar control. Even moderately elevated glucose levels can damage the inner lining of blood vessels over time. This damage affects the endothelium, the thin protective layer inside arteries. When healthy, this layer ensures smooth blood flow. When damaged, it becomes rough and sticky, allowing cholesterol and inflammatory cells to accumulate. This is the beginning stage of plaque formation. Smoking significantly accelerates this process. The chemicals in tobacco smoke injure the endothelium directly and increase blood clotting tendency. Over time, this combination dramatically increases the likelihood of arterial blockage. Blood pressure management is equally important. Consistently high pressure weakens vessel walls and promotes plaque buildup, while uncontrolled fluctuations can destabilize already narrowed arteries. The goal is stable, controlled pressure under medical supervision. Physical health, lifestyle, and metabolic conditions all interact in determining stroke risk. This means prevention is not dependent on a single factor, but on overall vascular health. Inflammation also plays a major role. Chronic inflammation from autoimmune conditions, metabolic disorders, or lifestyle factors can slowly degrade blood vessel integrity. In some cases, this may present alongside other conditions such as skin pigmentation disorders, which can indicate immune system imbalance. Headaches are often misunderstood in this context. While many headaches are caused by muscular tension or cervical spine issues, changes in headache pattern combined with neurological symptoms may indicate vascular involvement and should be evaluated properly. The key message is that stroke prevention is not about reacting to a single warning sign. It is about recognizing patterns of risk and addressing them early before symptoms escalate into an emergency. By the time warning signs appear, the vascular system has already been under stress for years. These signs are not random. They are the final alerts before a potential major event. And this is where awareness becomes critical. Understanding what your body's trying to communicate can make the difference between prevention and permanent damage. Part 6. If even one transient neurological episode has occurred, whether it was vision loss, numbness, speech difficulty, or coordination problems, it should be treated as a serious warning, not an isolated incident. Even if it resolves completely, it indicates that the brain's blood supply has been temporarily compromised. The most important step after such an event is medical evaluation. This is not about assuming the worst, but about understanding the risk before it escalates. Doctors typically assess vascular health through imaging of the carotid arteries, long-term blood sugar testing, and heart rhythm monitoring to identify hidden causes. Each of these tests reveals a different layer of risk. Artery imaging shows structural narrowing, blood tests reveal metabolic stress that damages vessel walls, heart monitoring detects rhythm disturbances that can silently produce clots. Together, they help build a complete risk profile. From a prevention standpoint, reducing stroke risk is highly achievable when these factors are addressed early. Managing blood sugar, controlling blood pressure, and eliminating smoking are among the most effective interventions supported by research. Each of these actions directly reduces damage to blood vessels and slows plaque progression. It is also important to understand that waiting for symptoms to disappear is not a safe strategy. Transient ischemic attacks are not harmless events, they are urgent biological warnings. The highest risk period for a full stroke often occurs within days after these episodes. That is why immediate awareness and appropriate medical response are essential. Acting during the warning phase can prevent long-term disability or death. Ignoring it often leads to missed opportunities for prevention. Ultimately, stroke is not a sudden, unpredictable disaster in most cases. It is a progressive condition that develops silently over time and often announces itself before the final event. Recognizing those early signals gives you a critical advantage. If this information resonates with your own experience or helps you understand past unexplained episodes, the most important next step is to discuss it with a medical professional. Bringing specific symptoms to a doctor allows for targeted testing and personalized risk assessment. Health decisions should always be based on professional evaluation, but awareness is the first and most powerful step. Understanding what your body is trying to signal can change the outcome entirely. Because when it comes to stroke, timing is not just important, it is everything.